Welcome back again. So we're continuing with the discussion related with the disorders of respiratory system. We have seen two disorders, asthma and pneumonia. Asthma and pneumonia, right? And now the emphysema. This is also a very important disorder and the most frequently asked question. Most frequently asked question. And what is the reason for this? The reason the people will have emphysema is because of cigarette smoking. That is the reason. So, as a result of the cigarette smoking, lungs are affected. As a result of this cigarette smoking, chronic cigarette smokers, tobacco, people who constantly smoke cigarette will inhale these poisonous gases, right? Poisonous fumes into their lungs. As a result of that, what happens in the lungs? What happens in the lungs is, in the alveoli, these alveoli coalesce. What does that mean here? What does that mean here is, so here this alveoli gets joined, right? So we have millions of alveoli in the lungs for the exchange of gases, isn't it? We have this vascular sacs, millions of them present in the lungs. And this cigarette smokers, what happens is this alveoli gets coalesced. What does that mean here is the adjacent alveoli gets fused with one another. What does that mean here is, we have this alveoli, we have this bronchioles coming in, they get divided into respiratory bronchioles, and then we have all these alveoli, isn't it? We have all these millions of alveoli, one after the other. So this is what here. So I am taking two alveoli here. Yes, I am taking two alveoli. What is happening here is, when they get coalesced, they get fused like this. Yes, they get fused like this. As a result of that, what is happening? What is happening here is, number of alveoli is getting decreased. Yes, number of alveoli, which is supposed to be more, is getting decreased, isn't it? There are supposed to be 3 alveoli here. Because of the coalescing, because of this fusion, what is happening? Only one alveoli you are witnessing here. Bigger alveoli, yes, bigger alveoli, but only one. As a result of that, what is happening? The respiratory surface area is getting decreased. What is happening? As a result of this, surface area is decreased. What happened? As a result of this, the surface area is decreased. As a result of this, exchange capacity of the lungs is also reduced. Yes, that means the gases are not getting exchanged. That means the body is not receiving the sufficient amount of respiratory gases. That means, so this sufficient amount of oxygen is not being received, and the CO2 is not eliminated out of the body, which is very problematic. Yes, which is very problematic, and that is happening because of the cigarette smoking. That is happening because of the cigarette smoking. Chronic cigarette smokers will have this problem of emphysema. So this can be also, say for example, if I give a statement, emphysema is caused by Haemophilus influenzae. This is a wrong statement. Yes, pneumonia is caused by that. So for example, pneumonia is due to chronic cigarette smoking. So all these statements will be interchanged, or will be given in exams, and you got to be very watchful when you go through these statements. these are the alveoli. These are the alveoli where the fusion has taken place, resulting in the respiratory surface area getting decreased, resulting in the body receiving less amount of oxygen and less amount of CO2 is being eliminated out of the body. Okay, so that is related with the emphysema. And the next one that we have is bronchitis. So what is this one? This one is the narrowing of bronchi and bronchioles. Narrowing of bronchi and bronchioles. Why does that happen? Why does that happen is because of the inflammation that has taken place in the mucus lining. What is happening? There is this inflammation that has taken place in the mucus lining. Alright, if you see the conducting pathway in the nasal chamber and as well in the bronchi. Bronchi is lined by this mucus glands. Yes, and these mucus glands, this mucus lining is getting inflated as a result of that narrowing of this respiratory passageway will happen, leading to the condition called as the bronchitis. This is also a disorder. And the next disorder that we have is very important. Please to remember, among these two, emphysema is very, very important. The most frequently asked question. That is there. So the next one we're going to be dealing with is occupational respiratory disorders. Yes, what are these? Occupational respiratory disorders. Yes, the next segment is occupational respiratory disorders. What kind of occupation? Not all occupations, specific occupations which might have the damaging effects on lungs, especially crushing and stone breaking. Crushing and stone breaking industries, because in the construction we need to have gravel. Yes, we need to produce the gravel and we need to have the specified stones and we need to crush them. And when you do that, you are producing enormous amount of dust, which you inhale leads to the detrimental, damaging effects to the lungs. Yes, that is occupational respiratory disorders. We will mention some disorders related with this. One is the asbestosis. Asbestosis is the disorder which is in asbestos industries. You all know what is this asbestosis used for. Asbestos is used for to partition the rooms and as well as a roof as a roof for some households, and as well as partitionary wall to the building in the larger buildings, right? So these people who are working there will be exposed to this asbestos dust, right? Will exposed to this asbestos. They will be exposed to this asbestos dust. As a result of that, these people will have this disease, asbestosis. Then silicosis. These are just different kinds of industry. Obviously, the silica industry, and these persons will have silica dust. When they inhale this smaller particles, you would call it as silicosis, and something called siderosis. And this is the iron industry. And this is the iron industry, and if you inhale the iron particles, right? If they inhale the iron particles, it leads to condition called as siderosis. These are also very important. Please do remember all of this. And next one is something called black lung disease. Black lung disease. Black lung disease, and this is due to inhalation of. This is due to inhalation. This is due to inhalation of what? Inhalation of coal dust. We all know what the coal dust is, the coal industries. Say for example, in Telangana, Singareni, yes, is the place where majority of the coal is being produced and supplied to majority of the South Indian states, and as a matter of fact, many of the Indian states as well, majorly South Indian states. That is Singareni coal mines. People who are working in these coal mines will inhale this black coal dust, and they will have this black lung disease. And one more is the fibrosis. I'll just write this here. Fibrosis is, the accumulation of fibers in the tissue or the cells. Accumulation of fibers, formation of fibers, accumulation of fibers in the tissues or cells is called as the fibrosis. Right? Simply I'm not writing this here because I'm not sure whether it is being covered or not. That's why I'm explaining. Fibrosis, the accumulation or formation of fibers in the respective tissues and cells is called as fibrosis. That is the occupational respiratory disorders, especially the crushing and stone breaking. Crushing is this iron, silicosis, asbestosis, black lung diseases, coal dust, and fibrosis as well. And all of these are very important. They are asked in these matches. You are given two columns. and you are asked to match these columns, and you should be able to match. Yes, particularly this is the most confused and most commonly made mistakes, because nowhere we were mentioning the iron here. Say for example, if I say asbestosis, you can guess silicosis, you can guess siderosis. Kind of not relatable, not sounding as where is iron mentioned here. Yes, you might find yourself in soap here. Yes, because of this unrelation, not relating to one another. The terminology is not relating to one another. You might find yourself in a soap and make a mistake. So please be watchful here. Black lung diseases. Yes, It's not related to some bacteria or something. It's purely related to the cold or dust and fibrosis. Fibrosis simply is that. I'm just summing up the diseases. We have seen 5 different kinds: asthma, followed by pneumonia, followed by emphysema, followed by bronchitis, followed by occupational respiratory disorders. Yes, 5 different kinds also we have mentioned here. Yeah, and that is the end of the disorders of respiratory system and the end of breathing and exchange of gases. Next lesson, next physiology lesson, we shall deal with the breathing. No, sorry. What is the next lesson? That is body fluids, body fluids and circulation. That is our next part, and we shall be doing that. Okay. Thank you, and please do subscribe, do your part, and I shall be making all these videos. Yes. Thank you.